All right, Joe. I think we got pretty much a full house, so I think we'll get started. So first of all, thanks everyone for joining. You're in the right place for novel uses of RFID and sensors. And this particular webinar, we're going to focus in the healthcare area, so healthcare, hospitals, hospices, etc. There is an opportunity for Q&A at the end. If you put a question into the through the panel, we'll review some questions at the end.
Or we'll just hop in and interrupt you while you're presenting to ask it.
That's fine too.
I can do that.
Yeah. So for those of you that haven't seen one of our presentations and webinars before, we do try to cram it with a lot of useful information, but we do like to have a bit of fun with it along the way. So we'll try and make your lockdown, for those of you locked down, a little bit more amusing as well as informative, hopefully anyway. So with that, let's get started. So what we're going to do today is we're going to talk about some of the challenges that exist in the healthcare environment today. And as part of that, we need to kind of capture what is the value of healthcare. What does impact the value of healthcare? And then we'll step on to taking a look at how different sensors can improve that value, and then extrapolate further by taking a look at some use cases of applying those sensors to improve the value to healthcare. And then at the end of the presentation, we actually have a few announcements. And I think we teased, as we quite often do, that we had one announcement. Actually, the several announcements we have, so we'll be talking about that. And then we'll do a wrap up and Q&A.
That's right.
So without further ado, let's talk about the big challenge that healthcare has today. And that can probably be best summarized by taking a look at just how expensive healthcare is. And this is true worldwide, and we're showing some US healthcare numbers here. Perhaps the US is actually worse than most countries in this respect, but over 17% of the gross national product, gross domestic product, is actually spent on healthcare. And that is just huge. And it's growing year by year. And that's due to things such as an aging population, the complexities of healthcare, both the equipment costs, the difficulty in applying some of these new drugs. And then there's an issue of different countries have different economic incentives to drive down costs and improve efficiencies. And you could argue perhaps the US is actually the worst in that respect. But the US is by no means unique in that.
Of course, the British guy of the staff is poking fun at us.
Precisely, yes. We just have our problems at the other extreme.
Yeah. So at a high level, the cost of healthcare is a problem, but it's also an opportunity. And on our side of the world, the opportunity to serve this in a more streamlined way, it provides an opportunity for us to be of service and make money at the same time.
Yeah, absolutely. So another way of perhaps, we should also add, obviously with the lockdown and COVID-19 going on, obviously healthcare is a huge issue for everyone around the world today. But I think it's also a lesson to us, talking about leading on to the future. If you take a look at the past, we can see that pandemics they're not unique. They happen every couple of decades in one form or another, or in different locations, or more rarely worldwide. But certainly they're not necessarily hundreds of years apart, maybe decades apart. But anyway, so there's going to be others coming along, and we need to be prepared for them. So another way of just visualizing this real quick, and we're not going to spend much time on this, but you can just get an impression here. This is a summary of the cost to us as individuals, as a single family coverage, a single person coverage, or family coverage on the orange here. How much does it cost us in annual premiums in the US on an annual basis? And obviously the key message here is it's just getting expensive, right? This is, since the turn of the century in the year 2000, we basically tripled the amount of annual premiums. And this is just an example of, cost being passed through to us and the cost of healthcare going up dramatically.
Mhm. Just so a small comment on this. This is all inflation adjusted. So the dollars that you see in 2018 or 2018 dollars, and then what you see in 1999 is adjusted to 2018 dollars, so that you're not just looking at inflation. You're actually looking at with a true cost of this.
Yep. So, what are the goals of healthcare, or what should the goals of a healthcare system be? A lot of it is obviously trying to improve and provide the best patient outcomes. How do we improve the quality of lives of the patients coming in? But obviously, closely behind that is how do we do that with optimal efficiency? How do we make it? How do we apply those services at the lowest possible cost? And if it's one message that you walk away with from the webinar today, it's you need to have high quality data in order to improve those outcomes or improve those efficiencies. You need to be able to measure, and you need out of that measurement to have accurate data. Without accurate data, you're not going to be able to do an accurate analysis of that data, and therefore be able to derive from that improvements to either the processes or the equipment or the drugs, and then reiterate through that cycle: measurement, get data, analyze it, improve it. If you have bad data, doesn't matter what you do with that analysis, it's going to be flawed.
Right. So throughout this presentation, you'll see us walk through use cases and measure this, and you can do this, and measure that, and you can do this. There is something that's you should consider sort of overriding this, and we have spent a ton of time thinking about the integrity of data. Is data actually what you think it should be? Data privacy, data security, data encryption, and that's a layer that goes on top of this. We're not going to talk about that today. If you've got significant business opportunities that really need a different level of integrity in your data, so that you can honestly say to somebody, I guarantee that the data that I've read is the same data that you meant to be, come talk to us. We'll bring you under NDA and show you how we can help you there. But that's a layer to this. We're going to talk about use cases. On top of that is how do you actually make this stuff secure, private, and the data have good integrity. Back to you, Neil.
Sure. On the right-hand side, I mean, I'm not going to go through this, but on the right-hand side, there is actually kind of a process that was proposed by the Harvard Business Review, for example, of how to take a look at a particular condition and how to review that and improve it. And we're going to focus in on the logistics side of this, as well as the data integrity side of it, and more generally, how do we improve these patient outcomes as efficiently as possible. So with that in mind, let's take a look at patient outcomes. What contributes to, or what can contribute to patient outcomes? And really the conclusion out of this is going to be we need to have accurate quality data in order to improve these outcomes. From a drug perspective, it's going to be about asking questions about, do we have the right drug? Are the drugs available? Are they valid? Do they have an appropriate expiry date? And then you get into questions about dosage, instructions, how do they get administered? And then on the equipment side, similar, but inventory. Do we have the things we need? Are they at the location that they need to be at? And then we got the added complexity of maintenance cycles. Are they off being repaired? Do they need to go in for servicing? And then getting those to the right location, whether it be when needed or for inventory and storage.
Yeah, and a couple of comments here. One is, if you look at, particularly on the equipment side, it looks like a regular factory. And you look at that and say, okay, is the inventory known, location known, maintenance schedules? That's just like a factory. The real difference and the real challenge that healthcare professionals face is that a lot of their day is unscheduled, and by unscheduled I mean that they don't control the schedule. Sick people don't come in at a precise time, and things happen, and that creates real opportunities to help people on the efficiency side. There's a real interesting pair of studies, one in the UK and one in Canada, where they simply asked nurses, what do you do all day? And where do you spend your time? And both of them, two different healthcare systems, both of them came back and said about 25% of the time is chasing down equipment. And so, there's a huge opportunity to make their lives better and to make healthcare better if we can answer those questions on the right cleanly and make it really work for them.
Having things on schedule 75% of the time, it's a bit like working for you, Joe. Okay. Moving on swiftly. So we've taken a look at patient outcomes. Let's take a look at the efficiencies, what contributes to the efficiencies. And again, the argument here is if you don't have accurate quality data, you're not going to be able to do the key measurements and improvements to these efficiencies. And when we talk of efficiencies here, we're talking of either dollars or percentages, so effective dosing and equipment costs, but also how do we utilize the equipment? How do we utilize that staff best? And you start getting into questions like where is something, when is it ready, again, repairs and maintenance, etc. Where is it needed, and how do I improve that utilization? That's what this is all about. So without that data, you're not going to be able to answer those questions. You're not going to be able to improve those. So there's more than one sensor available to us all in being able to apply sensors to these problems in order to kind of help. And I'm not going to go through all the gory details here, but obviously RFID is one of them, a key one, doing a lot of the track and tracing and answering the questions such as, do I have something? And to a certain extent, where is it? And that can be enhanced with sensors, passive sensors that can start answering questions about the condition of something. And Bluetooth low energy sensors, having a bit more memory and storage, can do a little bit more. GPS starts giving you a better accuracy of location of the item. So you start to build up with a couple of these different sensors, a lot more knowledge about the condition, where something is, and then it's going to be able to give you that quality data that you can start to analyze and improve on those efficiencies and those costs. PIR sensors for looking at movement, radar, even more so. Video can be useful, but sometimes in hospital that's a problem. So maybe radar comes in useful then. So combining a couple of these sensors gets kind of interesting.
Hang on, one of the things that we have experienced when we talk to people about various multi-sensor applications is it's a little bit rough if we say, look, you have these 27 sensors, what do you want to do? Because people that's not how their lives work. It's a lot better if we can just have a dialogue about what is in the room, or what is in the passageway, or what's going through the door, and what are you trying to achieve? And then we can come back to you and say, well, look, if you want to count people, but you want to do it anonymously and you want to observe privacy, radar's a great way to do that. Or if you say, well, look, I really want to know the temperature in the room and count some inventory in the room, we can bring a specialty tag and do RFID to count the inventory. But that's a nice place for us to have a dialogue. And we understand it's a little rough when we put, 45 sensors in front of you and say, please choose. Anyway, back to you, Neil.
Yep. Well, the point is you don't have to choose. You can select a bunch of them. Okay, so with that in mind, let's go ahead and take a look at...
Wait. Everybody...
You had to go there.
I did. Everybody noticed that video. Neil did that, and there was like no guardrails, there were no training wheels. He did it all by himself. So everybody that's proud of Neil, give him a thumbs up.
Moving on as quickly as I can. So let's take a look at some of the applications. And the first one is looking at the use of pharmaceuticals through the supply chain and inside the healthcare environment. And the key message here is that really this is no longer just about tracking. Yes, the technology we have can track through the supply chain, it can track through hospitals. But if you look at the conventional approaches, traditionally it's been done with barcodes, manual input into computer systems, and When we talk about manual input, clearly that means humans. And guess what? We all make mistakes. So data, bad data in, bad data out, right? Data integrity is something that the industries tend not to talk about and really should. This is something which is going to be increasingly important as we start to use these technologies more in these environments. Having the wrong drug at the wrong place or the wrong drug administered is going to be kill someone, clearly. So it's hugely important to have data integrity. And also to monitor the condition that these pharmaceuticals are stored in and used in. So with applying some of these sensors, we can start to, for example, RFID, clearly, we can start to automate some of these processes, the stock refills. We can measure how many pharmaceuticals or what type are in a certain room in a certain area. We can improve on that distribution capability. So we can monitor the expiry dates, and then we can actually prioritize based on those dates which drugs should be used first. But we have additional sensors now that can also take a look at temperature and moisture, even without batteries. So passive RFID sensors that can provide additional information about the environment that these pharmaceuticals are being stored in. And then we want to be able to track and trace this. And you'll see this in a couple of slides' time where we start talking about, we now have RFID at a point, at a low cost and a high read point. And we'll talk about that. Being applicable to these applications. So we're actually driving down costs of these technologies. They are now much more usable in healthcare environments.
Yeah, a couple of comments here. And again, we're providing a ton of information. We are very sensitive to people in the medical community and people in hospitals and pharmacies. They're busy people. And if you come in and you overwhelm them with they have to change a whole bunch of things, that's a really tough sell. And so much of what we're trying to do here is do things that make their lives easier and do that in a way that doesn't require a massive amount of change. So things happen subtly in the background and you don't have to throw away something, or something happens and you don't get a confusing output on a instrument. And that's a big focus. We want to make sure that you understand we're very sensitive to your customers in the medical world having their own lives, and we need to make things easier, not harder for them.
Yeah. By the way, we just had one question, someone asking about whether we'll make these slides available afterwards, and yes, we will. We won't even charge for them. We'll give them away completely free. Okay. On to
Neil's favorite
go
topic.
ahead and say it. Go ahead and say
it. It is your best topic. Okay, we went through this presentation and we were told that we couldn't joke too much about Neil's adult diapers, so we won't joke anymore about Neil's adult diapers.
Thank you very much. I mean, joking aside, I mean, this is actually a very, very serious application. We do like to kind of keep this lighthearted and keep it free flowing, but it's a serious application, right? And if we take a look at some of the conventional approaches, adult diapers, I mean, you have people in care homes and long-term care, and how do they communicate sometimes? Sometimes they're not able to communicate when they need changing, and it can be left wet or soiled for long periods of time.
And even the process of checking is pretty intrusive, right? If somebody, for an elderly person, if they're coming in every 2 hours to make sure that you're dry, it's just the sense of privacy is really harmed. And this gets around this. You can put a tag into a diaper and passively interrogate whether the person's dry or not, and instead of waiting 2 hours to be changed, you're informed right away whether somebody's wet or dry. And when they get to a situation of wetness, the nursing staff or the care staff is told straight away that there's an issue that needs to be resolved.
Yeah. And by combining an RFID tag with the on-chip sensors, have two sets of information, right? You have information about the dryness of the patient, but you also have a unique ID on this RFID tag, and that can also report on which antenna it's been read on, whether it's been read in this room or that room. So you also
Right.
have awareness of where that person is, as well as the condition they're in, and that's kind of the little visualization there on the bottom right. So, green, you're dry; red, it's a problem. If they're not in their room, are they still on premises? Okay, they're fine; they're in the TV room, etc. So you really do start to solve a couple of different problems here very, very quickly.
So Neil, I think we kept this professional. We did a good job.
I think we actually did a good job on that one. Yeah.
Staff is going to be proud of us.
So the next element of this is how do we take some of these technologies mobile and start addressing some of the requirements in terms of ambulance management and the assets and drug management inside ambulances. And again, with conventional approaches, normally the ambulance is stocked up at the beginning of a shift, and maybe use barcodes, maybe there's a handheld involved or a tablet, and again, humans make mistakes, so guess what, manual entry is a problem. So again, looking back at some of those sensors, we can start to apply those to the situation here. So we can now monitor the whole environment inside of the vehicle, monitor all the drugs and the equipment there. We can take a stock of what's in there. And with the communication from the vehicle back to either the ER department or the ambulance facility, we can now provide real-time updates as to what's going on with that equipment. Combined with another sensor, GPS, you now know where the vehicle is. So when the vehicle is returning to a location, which can then potentially provide some additional stock to the vehicle that might be needed. So it's really about getting what is needed to the vehicle as soon as possible.
There's secondary things here too. Because our readers are Bluetooth enabled, we can pair with a phone or a tablet that the staff of the vehicle have. So there's lots of layers of what can we do. We can say whether or not the people who are in the ambulance are still in the ambulance, or whether they've gone someplace remotely. When do they come back? If they come back and they leave a place and the inventory is missing something, we can alert the hospital or the ambulance provider that they've left something back at a site. And all of those things can be provided in a way that's largely invisible and certainly doesn't intrude upon the work of people.
Yeah, indeed. So let's take a look at example hospital layouts here, and the numbers here are representative of how many beds are in those particular rooms, and we're just trying to show really some examples here. But traditionally, RFID has not been particularly cost effective in these kinds of environments. It's been used maybe at choke points, so big doorways, so we know if something's coming in and out of a certain area. But that's great. That does allow us to do tracking and tracing of both drugs and items, patients and staff, but not down to the bed level. So now, with the cost-effective nature of the technologies we're exploring here and we're talking about here, you can actually apply these technologies very cost-effectively to this environment. So we can actually have a single RFID antenna per bed. And for example, in the monitoring of diapers, we can have a very cost-effective system which is monitoring each bed now. And as you can see from the diagram here, the blue lines there are Ethernet cables, and that's it. That's all you need. So it's all about low-cost installation, simplicity, no conduit required, no power being required. It's just routing of Ethernet cables between this equipment. And right. you don't have to route all this stuff all the way back to head end. You just daisy chain these things together. It's very cost effective, down to the point now where for about $2 per square foot, you can install this equipment in these rooms.
So this is an interesting figure, and everybody looks underneath the antenna and says, well, that's a bed. And again, one of the things that we want to make sure that you're aware of is it is true that we can monitor an adult diaper and a person in a bed in this configuration, we also want to make sure that you understand that all of the readers bring additional capabilities. So we can also monitor the inventory that's around that room. So what equipment is around that bed, and that's an RFID task. But we can also monitor not just the moisture in the diaper, but we can monitor the temperature in the room. There's a variety of things that can be monitored, all with the same thing. So when you're looking at a $2 per square foot charge, that once that's installed, it gives you a lot of capability for things that you may not have thought of before.
Indeed, yeah. We actually have another question, which is, do we have all? Yeah. Do we have all the devices that are mentioned here? And we'll talk about some of that clearly in the next couple of slides, actually.
Yeah, the answer is yes. Neil makes things kind of hard sometimes.
Yeah, and we also have access to all of these sensors, whether they're internal inside of these devices, or we have the expertise to provide all these sensors. So a more traditional approach or more traditional application is tracking items through the hospitals themselves using fixed readers. But now we can install these overhead and cover areas as well as choke points. So this will lead to much more accurate reporting of where things are, as well as what things are, and are they in the appropriate condition. And we had an interesting client, interesting customer in Europe, and they were actually tracking shoes. In addition to scalpels and things of that kind, they were actually having to track the shoes because they were supplied by the hospital and required tracking because they were unique to an individual. And they were actually having a problem when, with a large circulation of staff, that some of these shoe storage areas were just getting chock-a-block with bunches of shoes that were no longer being used by people. So they needed an RFID solution there to assist in that. I'm sure there's some jokes there somewhere, but we'll leave that for later.
Actually, I'm answering a question. So it's kind of funny because I'm trying to man the Q&A thing, and while you're talking, I'm manning the Q&A thing. So I'm not so good at multitasking.
So let's take a look at the key solution considerations. What are some of the things that, as you take a look at these healthcare environments, what should I think about? Well, thinking about the identification of items, and that's largely resolved and cost effective now through RFID. The condition and status of things, and again, we've covered that with sensors, passive sensors and Bluetooth devices. Connectivity, now that's cost effective through the delivery data and power through Ethernet and daisy chaining devices together. And you'll see on the next slide, when we start talking about one of our products, the SensArray, mounting these things is actually kind of important. Where can I mount them? Can I put them on ceilings? Do I need an enclosure for it? If I have an enclosure, it's going to get hot. Does that mean I've got to have a fan in there? All kinds of issues like that we've been able to resolve, which kind of hints at Chris's question. In terms of installation, obviously cost and time is critical, as is the robustness of these devices. And by that, we don't just mean longevity, but how easy are these things to maintain and clean? Can I spray the thing with disinfectant, which is obviously important today, and wipe the damn thing down and I'm done with it? What about the environment it's in? Is it flammable? Temperature, humidity? And then extrapolating all of that and being able to put it into a vehicle, which is battery powered now with GPS. So all those are all important considerations, and these sensors that we've been talking about today can all be applied to these considerations.
Yeah, a couple things. So first, Neil, wonderful job with icons. I mean, they're really cute, and I mean that from the bottom of my heart.
Yeah, that's my arm on top of robustness, I'm sure. I wish.
One of the things that a slide like this does is it talks about things in sort of a general way, and I'm going to talk about a couple things that are specific. One is a lot of our products are IP67, including one of our readers, and IP67 readers just don't exist. And when you take a non-IP67 reader and you take it into a hospital environment, there's lots of things to think about, particularly in regions that have regions of high oxygen, or anywhere that there would be a flammable gas. And the reason is because it's not IP67, the outside gas is exposed to electrical sparks that can happen in normal operation. And that's a colossal pain in the backside. And typically what people do in robust situations, they'll take a reader and they'll put it in an IP67 box, and then it can't dissipate heat, so you have to bring a fan in. IP67 gear, native IP67 gear really gets around that, and you can install this in a lot of places that are pretty tough. The second thing is that all of our equipment is made, the external surfaces are either aluminum or polycarbonate, which means that they're suitable to be plenum rated. That means you can put them inside a wall, you can put them above a ceiling, you can put them underneath a floor without really having any issues on the safety side.
Yeah. I saw one of the questions that came up that you answered there, Joe, which was, how do we solve cross reads? And we won't go into all that right now on this webinar, but oh boy, do we have a solution. Cross reads are largely resolved by adding a very low cost sensor into the environment. And so people who are interested in how you solve your cross reads, come talk to us.
Yeah.
So we're talking about the reader and how it can be applied into the environment, and can it go on ceilings and walls. And you can see from the Sensor Enterprise reader, you can see on the right hand side here, it looks like an antenna. It's thin, it's got the antenna built in, it's got the reader, it's got the power routing, it's got the data switch in there, it's got GPIO built in, with no need for an external GPIO box. So full power capabilities of an RFID solution that can be applied into a ceiling or a wall, or even underneath a bed for that matter.
Right. And when we say there's no need for an external GPIO box, there's the external GPIO box that has the switches and stuff. Not only do you not need that, but we also, because we think it's our obligation to provide power to devices, we also power all of your GPIO devices. So there's a 24 volt, 30 watt power supply available to you to run your lights or sensors or whatever.
Yep. And then on the, we have another reader called the SensThys Extreme, which is, as you can see, very robust. And it's IP67, which basically means it's more than resistant to water and moisture and dust. And so it can really be used in some pretty harsh environments, even directly outside, quite frankly, without, it was actually designed for Australian outback and could be used in Alaska during the winter. But in a hospital environment, it could be sprayed with disinfectant and you get on with life. It also has a whole bunch of sensors in there which actually contribute to providing situational awareness, GPS for location, accelerometers, basically most of the sensors you would normally expect in a cell phone.
Yeah.
And it's robust. Yep, you can stick it under a meter of water. You can cold start it at minus 48.5 centigrade. There's some dry ice underneath there. If you want to park a car on it, go right ahead. And when it gets dirty, you just wash it down afterwards. So, and again, all joking aside, I mean, washing these things down is going to be really important in the healthcare environment.
Yeah, and a couple of things. First, hats off to our business partners at MTI. They were the guys doing the cold start on top of dry ice. We also took one of these devices and put it in a cooler with dry ice, which I think is minus 85 degrees C. And then we just poured onto the device boiling water. And we've done that with our antennas. We've done it with our readers. And that even that extreme of a thermal shock, these things hold up just fine. So
cool. So with that, We've got a few announcements. So a couple of important ones. So in terms of certifications, the SensArray Enterprise you saw there earlier and the SensArray One are now certified for use in Europe, ETSI certified. And the SenseX Extreme is just finishing off going through its Canadian certification. So it can now say A.
Gosh, that was like a joke, sort of.
It's like a joke, but with the humor taken out, yeah. And then on the software side, the much loved LLRP.
Our software guys say that it's just so slick and so elegant, and we just love it, really.
But customers do need it. So we have completed the port of LLRP to our reader infrastructure. So if people need to port from one reader to us, they can go ahead and do that now with LLRP.
Right.
And we've also updated the firmware on the SensArray reader, so it can communicate more information through the lights that are on the reader. So we have this little Morse code thing that will tell you which antenna is being used at any moment in time. And another thing kind of hiding underneath the surface, which is you can't kind of touch and feel per se, but is incredibly important to anyone using this type of equipment, and even more so in the hospital environment, is can you trust this equipment to be relied upon, and how long can it be up before there's issues with it? And we're up to the 5 nines right now. And obviously we're not stopping there. We'll continue to improve quality and reliability way beyond that.
Yeah, there's another thing that we've done before, and I'll just mention it because we have a lot of new people on the call. We have something called Command Center or Control Center, and basically it will look at every sensor that you have up and running on the network that comes from us, and it'll give you an operational status. So you can, at a single glance, you can look at the network and make sure that everything's up and running. If you do run into the situation where something has ceased running, it provides you the ability to remotely reboot it and get it back up and running.
Yep. And then finally, in terms of announcements, so we are fully operational with both the Axon Magnus S2 and S3 based tags. And what that really means is temperature and moisture sensors. So we're able to interrogate all kinds of different tags using those chips. And we have a developer's kit for customers who are interested in exploring RFID and passive sensors together. So that's available now.
Right, a couple things, and we've already had a couple of customers come in and say, can I have something that measures temperature plus or minus 0.2 degrees? And the answer is no. These are good for relative temperature or relative moisture. We use them in a lot of industries to say, is it dry, damp, or wet? But if you're looking for something that says 11% moisture versus 10.5% moisture, these really aren't that accurate, but they are very inexpensive in terms of sensors, and they don't need a battery. They can go in a lot of places.
Yep. So, if you need to know something's dry, moist, or wet, this is your solution. And last of all,
oh yeah.
With the ding.
Wait.
You're going to do a ding for me.
Yeah, you do something like.
Jeez.
We have to do something to maintain sanity. It's funny because we're used to doing these webinars in person. So me and Neil sit next to each other and we sort of look at each other funny. But it's really hard to do these, sitting by yourself, and have no idea if you guys are finding this humorous or not. Hope so.
So we are now shipping the SensArray One, and as a clue in the name, there is literally only one connector on this reader antenna power combination. So it almost looks like a networked antenna. So the antenna is built in, full 33 dBm reader inside of there, and so power and data is delivered through that Ethernet Cat6 cable that you plug in there. That's it. There's no other additional antenna on it. There's no GPIO on it. It's a very targeted, let's say, RFID solution, but very easy to install and very low cost installation. It's literally just that one cable. So that is available. So we realize we've given you quite a lot of information there. If you do have a few more questions, Joe's at it again. If you have any more questions, we'll be happy to answer them for you. Feel free to reach out to us too. And we should probably we'll make sure we have all of our contact information available, so you can reach back out to us if you do have further questions after the webinar here. Right now, I'm not seeing any more questions. People are typing.
Yeah, we'll give people a second to type things. Maybe they've got questions, maybe they don't. But I do want to let everybody know that everybody seems to like your graphics. I mean, the votes are just screaming in. Okay.
It's a sad state when the best point about a presentation is the graphics.
We'll give a couple more minutes and wait. So the question is, did you buy the team flowers for implementing LLRP? And the answer
is no, but they are receiving treatment now.
The answer is you put a bad idea in their head. Actually, what they probably need is booze.
Yeah.
Actually, we should. I mean, it was just an early standard. A lot of the standards in this industry have been around for a little bit, and honestly, it is a standard that exists. A lot of people use it. It's certainly popular in some of the folks that are serving the medical industry. So yep, we've done it, and happy that we did.
Yeah. Okay. Well, I think yep, no more questions. So thanks everyone for attending. Hope you, for those of you that are in lockdown, stay safe. Thank you for joining us, and I hope you found it useful. We will go ahead and give you access to PDF of the presentation. And we'll put this, publish the video of the presentation material as well, probably in a few days. Just take me a couple of days just to get together. There was one more question. What is the medium?
Oh, wait, there's another question.
Yeah, how do you contact us? So you certainly can contact us through the website. Feel free to, just to keep it kind of simple, if you just send an email to info@SensThys.com. I keep a regular eye out on that email account, or feel free to email me. I'll broadcast this here. Feel free to email neil.mitchell@SensThys.com, and my first name's Neil. If I can actually type here. Only have trouble, but feel free to. Yeah, there we go. Send an email to either one of those. We monitor, obviously I monitor my own email, but I also monitor the other email account as well. So we'll be happy to respond to you.
Right. Although we're not physically at the office right now, we do actively monitor all voicemails. So if you just call our main number and leave a message, we'll get back to you within, I don't know, typically a couple hours to chat with you about what's up.
Yep, indeed. Okay, well, thanks everyone. Have a wonderful rest of your day wherever you are, and stay safe and healthy.
Bye, all.
Bye-bye.